This is Dr. Stewart, Timonium Foot and Ankle Center. Good morning. I just wanted to show everybody a quick case of what we think is gout. Why do we think this is gout? Well, this nice young lady is taking a thiazide diuretic, which is a blood pressure medication, and thiazide diuretics are known to increase the uric acid levels. This was a fairly rapid onset. Would you say this came on kind of overnight?
Yes, it did.
Yeah, and she's having the classic pain right here, right around the first metatarsophalangeal joint.
Okay.
She's also having a lot of pain around her second toe. And if you look real carefully at this second toe here on the side, if you look under the skin, you can see that little white area. And that white area is actually a buildup of gouty tophi. Gouty tophi is basically an accumulation of uric acid, and uric acid builds up and it's almost like a white chalky material. And when we do surgery, we will commonly see these intraoperatively. You can see that she's got a lot of swelling on the top of her foot, and I'm trying to be gentle here because this is painful. I can tell you this is hot, and a lot of times patients will get these and they'll think that they may have an infection. But when something comes on rapid in onset in this nature, it is highly unlikely that there's going to be infection, because infections don't generally start overnight and there's no trauma. There are no open wounds. If you look in between the toes here, we don't see anything in between these toes that are consistent with a wound. I'm trying to be careful, I'm sorry. We don't see any wounds. We don't see any puncture marks on the bottom of the foot here. There's nothing here to suggest trauma. So I have a couple different options. When this is diffusely red and hot and swollen like this, we want to get this pain down. And what we're going to do is get her on some oral steroids. Oral steroids versus steroid shots can be used, but when it's painful and swollen like this, oral steroids tend to do the trick. And then what we will do is we'll get her uric acid levels under control. Because she has a known medication that is causing her uric acid levels to likely be higher, we're going to first start by suggesting modifying her blood pressure medication. If we change her blood pressure medication and she continues to have elevated uric acid levels, then we'll start making some medication. We'll start providing some medications to lower the uric acid. The blood pressure medication, of course, will be adjusted by her primary care provider. And we'll work together. So this is how we work with other doctors to make sure we give comprehensive care to the patients. It's important that we control this so that she doesn't get this repetitive attack here, because ultimately what will happen is, how we saw that little white spot on the side of the second toe, she can build this chalky material in all of her joints. And in fact, she said she notices some of this in her hands, and she didn't even know until recently that she had gout. She actually was seen a couple times in an urgent care setting, and there was concern with infection. So now that we have our diagnosis, we're going to make sure we attack getting these uric acid levels down so she does not have to go through these chronic episodes of pain, and also to prevent her from getting destructive arthritis. In cases of gout that get really bad, we'll end up having to go in and fuse these joints with surgery, and if we can avoid that, we'd love to. In cases where gout is not controlled with oral medication, there are in fact IV infusion therapies that can actually really wipe the gout out of the system. That's generally not needed, but there are some options. So I appreciate everybody taking the time to watch this video, and if you have any questions, you can certainly visit our website at www.timoniumfootandankle.com, or if you have any questions, you can call the office at 410-560-2777. Thank you.